Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Welcome to today's show. We are discussing a disease that is disturbing so many Ugandans of late. This month is World Diabetes Month, and with me in studios are experts in the field of diabetes. We have Dr. Piloya Teresa, a pediatrician by training, and is also a member of the National Committee of the Uganda Diabetes Association, and Dr. Lumu William, who is also the president of the Uganda Diabetes Association and a diabetologist or a doctor who specializes in diabetes care. So we are here in studio to discuss diabetes because we are commemorating the world celebrations on diabetes. And I am your host for the evening, Dr. Darius Owachi. We are pleased to have you on the show, doctors.
Thank you.
So let us get down to business straight away. So we are here to raise awareness about diabetes, educating the people on what diabetes is and how people can prevent it. Maybe I would start with you, Dr. Piloya. You could help us tell the people what exactly diabetes is.
So diabetes, in simple terms, is a disease which is due to high blood sugars in the blood. So a viewer out there would want to know, why would I have high blood sugar in the blood? So every day we eat, when we eat food, food is broken down. And when food is broken down, we make sugar. This sugar that the food makes is supposed to give us energy. But as that sugar gives us energy, it has to be taken up by the body to give you the energy. So what really happens in diabetes is that when that sugar is produced, a chemical which is called insulin is lacking, does not actually force that sugar to get into your body.
Okay. Yes. So this, so you're trying to explain that the blood sugars are kept within a certain range within the body, and it is regulated by substances or chemicals called hormones. And one of the hormones you've highlighted is insulin.
Yes.
Yes. Dr. Lumu, could you help us understand what this insulin hormone is? What exactly does it do? Where does it come from?
The insulin, as Dr. Teresa said, comes from an organ in our body called the pancreas, and the pancreas is located behind your stomach. The stomach is somewhere up here. So behind it, there's the pancreas, and in the pancreas there are cells that produce insulin. And insulin is produced on demand usually. As she has said, when you eat and your blood sugars go high, the pancreas secretes this insulin to try to regulate one's blood sugar.
So yes, the insulin helps to bring down the blood sugars when it goes high. Yeah. And if the blood sugar goes too low, what happens?
It is the production of insulin by the pancreas is regulated by the amount. For example, the blood sugar must go beyond a certain value for it to be stimulated to be produced. And then if the blood sugar goes below a certain value, the production is switched off automatically.
Okay, yeah. So it's like some sort of switch mechanism.
Exactly.
If the blood sugar goes too high, the insulin increases so that it reduces the blood sugar. Yeah. And if it goes too low, it stops being produced, or some other chemicals come into play that will attempt to raise the blood sugar. So this is like the basic understanding of the blood sugar control. So in diabetes, when we're talking about the disease in diabetes, what exactly happens, Dr. Piloya? What goes wrong when someone fails to control their blood sugar?
So we have what we call type 1 diabetes, which is common in children and young adults, less than 25 years of age. And this type of diabetes is due to destruction of your pancreas, and so you do not produce insulin because insulin is produced from the pancreas. So some infections are thought that they could actually destroy the pancreas, viral infections, common viral infections. And of course, there are many trauma. For example, if you get involved in an accident, yes, it can also destroy the pancreas. Some drugs we take can actually destroy our pancreas. But also, in children, we know that some children are born with either a very small pancreas or the pancreas didn't form at all. So that is usually the commonest cause of type 1. Type 2 is what we commonly see in adults, older people. And in this one, the body produces less insulin, but it's less than what they require. But also, that insulin that the body produces does not work well. So what you would say, there's some resistance to that insulin. So as adults, when we get older and we begin to gain all this weight, we change the way the body works with the insulin. So the cells cannot actually sense that there's insulin. So you need very large amounts of insulin to be able to lower your blood sugar.
Okay, so sometimes people think that the type 2 comes with weight. Is that a correct assumption? When someone gets too big, that they'll have type 2
Yes
diabetes?
and no, because we've seen in our environment many small people actually getting type 2 diabetes in our environment in Africa. So it's commoner amongst the big people, but it can happen in someone as small as you, Darius.
So, Dr. William, type 1 and type 2 seem to dominate the scene, but are these the only types of diabetes that is common, that is known?
There are other types of diabetes. One big group is gestation diabetes. This usually occurs for the first time in women who are pregnant. A lady could have been asymptomatic and basically well, as to why, if I'm to put it that way. But then as they come, they have a sugar which is not too high to be called diabetes, but at the same time it is not normal, as to where it's not normal, but it is in that medium range that is dangerous to the baby, and also later on in life it can predispose this lady to developing type 2 diabetes when they later on, and even the children they produce to have type 2 diabetes or diseases of the heart. So that's what they call gestation diabetes.
So talking about diabetes, you know, very many people are very concerned that diabetes is on the rise. Just how common is it in your experience, Dr. Lumu? How many people do you think have diabetes in Uganda?
Yeah, diabetes type 2 is quite common. About 1 million Ugandans have diabetes. Unfortunately, another 500,000 people do not know that they have diabetes. In fact, that they are living a normal life as to where. So once you see one patient, once you see 2 people with diabetes, there is always another person who is not diagnosed with diabetes.
So you're saying currently there are about 1 million people
with
in Uganda who have diabetes. That means they know it, or they know they have diabetes.
Yes, exactly.
But there might be an additional
500,000
who don't know.
But I must stress here, one might look at 1 million out of 40 being small. The problem is that many of our patients report hospital late with a lot of complications, which complications cause a high burden to them in terms of cost, in terms of life, in terms of being ill.
Okay.
For children, it's about 100,000 children. Those are children less than 18 years who have diabetes. But like I said, there could be more because there are so many children out there who are being treated for malaria, who are being treated for diarrheal diseases, and so many other things, yet they have diabetes.
It could be diabetes.
Yeah.
Some children are thought to have a gene that may predispose them to advancing, to destroying their pancreas. So there may never be a family history, but the genes of that particular individual predispose them to getting the diabetes.
So it can be linked to particular gene components,
Yes,
especially in children.
especially in
Could
children.
there be also other factors related to children that would predispose to the diabetes?
No, currently we know that children also get type 2, and so the risk factors are the same as the risk factors for adults for getting type 2.
Okay, so
Yes.
after the break, we'll be back to discuss more about these risk factors that tend to cause diabetes both in children and in adults, and how we can identify diabetes, and most importantly, how we can manage diabetes and prevent it. So remember to send in your questions, comments, and feedback on our social media platforms, and our doctors will ably respond to them.
You are watching the DocTalk Show.